We're going to talk about one of your worst nightmares, a preemie delivery in your ED. I have nothing to disclose. Imagine this scenario. EMS calls ahead. They're 2 minutes out with a woman in active labor. She's had no prenatal care, and she has no idea how many weeks pregnant she is. This has the potential to be a true nightmare scenario for you. Just a few of the thoughts that are running through your head. How can you rapidly determine gestational age if there's time before she delivers? What if there's not time and the baby's born? Is there a way to determine that baby's age after delivery? And if that baby is extremely premature, are there any recommendations for resuscitating that infant? If there's time, you should make every effort to determine gestational age before she delivers. Currently, there are 4 ways to date a pregnancy. The first is by assisted reproductive technology, specifically IVF, and this is the only circumstance where the exact date of conception will be known. The second way to date her pregnancy is by her last menstrual period, and historically this has been used to determine gestational age. The problem with LNP, though, is that many women can't remember what that date is, and even if they do remember, it's often not all that accurate. The third way you can date her pregnancy is by your physical exam. As a general rule, the uterus reaches the umbilicus at about 20 weeks, and it grows approximately 1 centimeter per week. So if you measure from her pubis to the top of the fundus, the number you get in centimeters should correspond roughly to the number of weeks pregnant she is. Of course, the fourth way to date the pregnancy is by ultrasound. The most accurate way to date a pregnancy, unless she used IVF, is by early first trimester ultrasound measurement of crown rump length. The best case scenario is that this patient that is about to deliver in your ED had an early first trimester ultrasound which determined her due date. If she did, that date is going to trump whatever ultrasound you might perform right now in the emergency department. Well, what if she didn't have prenatal care? She never had that early first trimester ultrasound. Can you quickly do an ultrasound right now to determine her gestational age? The answer is yes, you can, but unfortunately, ultrasound accuracy gets worse as pregnancy progresses. This is because babies early in pregnancy are nearly identical in size. But as pregnancy progresses, many things can affect fetal growth, and the differences become more apparent. As a general rule, ultrasounds in the second trimester can be off by plus or minus 2 weeks. And at the very end of pregnancy, in the third trimester, your ultrasound can be off by plus or minus 3 weeks. So in other words, all 3 of these babies could measure the same. A large 23-weeker could measure the same as an average 24-weeker, which could measure the same as a large 25-weeker. Well, you might say to yourself, well, who cares? So what if I'm off by a week or 2? What difference does it make? Well, at the cusp of viability, 1 week can literally mean the difference between life or death. At less than 22 weeks, that baby has essentially 0 chance of survival. On the other hand, at greater than 25 weeks, the majority of babies not only survive, but survive without any significant long-term disabilities. Babies between 22 and 24 weeks are considered to be in the gray zone. This is the limit of viability, where that baby has about a 50% chance of survival. What if there's no time at all before she delivers? The baby is being born. What do you do now? Is there a way to determine that baby's age after delivery? And the answer is yes. You can use an assessment tool called the New Ballard score. And this uses a combination of physical and neurologic criteria to help estimate the gestational age of that baby, and it can be applied to babies between 20 and 44 weeks. Now, the entire Ballard assessment is pretty involved, and I don't think it's practical for us to go through this in the emergency department, certainly not at the bedside when a delivery is imminent. But if you can remember 3 things, this can help you rapidly assess that baby's gestational age. Those 3 things are the eyes, the baby's skin, and its feet. Start by looking at the eyes. Term babies will spontaneously open their eyes. If the baby is not opening its eyes, try to gently separate the eyelids. If those eyelids are fused shut, that's a sign of extreme prematurity. Next, look at the baby's skin. You're looking for lanugo, which is this fine, soft, white hair that's covering the body. This tends to appear between 24 and 25 weeks, and by 28 weeks, it's abundant. If you're looking at the skin and you see no lanugo, and that skin is transparent and thin and sticky, those are all signs of extreme prematurity. Finally, look at the bottom of the baby's feet. Term babies have fat feet with creases all on the bottom. An extremely premature baby's feet will be smooth and shiny, and there won't be any creases. But now for the really hard questions. Your worst nightmare has become a reality. You've just delivered an extremely premature infant in your emergency department. Should you resuscitate? Are there any recommendations to guide you? How aggressive should you be? Well, in 2014, there was a joint workshop between the AAP and ACOG, and they released the following recommendations. At less than 22 weeks, They don't recommend resuscitation and recommend you offer comfort care only.